So good morning everyone. Today I'm going to perform head and neck assessment. So first, what I'm going to do is perform hand hygiene. You should wash your hands, but in this case, it is okay to use an alcohol. Next is, we're going to assess the patient's head. Focus lang. Going to assess the patient's head. Let's look if the patient's head's skin color is this one. It is normal or abnormal. For example, if it's very red, then it is abnormal. If it's in another color, then it is abnormal. So this looks like a normal face. Next is check the head size. If it is normal for the head size to the body, or yeah, if it is, in this case, the patient's head is normal for its body. Next is, let's look for abnormal movements of the head. So please, ma'am, can you look to the left slowly, to the right? If there is twitching, then there is something wrong. Next is check if the patient's face, if it is symmetrical. So the eyes are level or the ears are level, and in this case it is level. Check. Next is test the cranial nerve 6. Oh, 7? Yeah, 7. Test the cranial nerve 7. So, ma'am, can you close your eyes and open your eyes? Close your eyes tightly, and open them. Okay. Then next is smile and frown. Frown. Okay. Next is puff up cheeks. Anak. Okay. So her cranial nerves are okay. So the next procedure is we're going to check her or the patient's hair. So in this procedure, we're going to use gloves to prevent contamination. Before wearing gloves, of course, perform hand hygiene. Okay. And the other one. We're going to assess her hair if there's masses or if there is masses, indentation, or skin breakdown. And the skin, feel the skin if there is masses or mga bag-ubag, burot-burot, o isa pa na. But in this case, the patient's hair is clean, not even lysis or photo. The patient's hair are clean. Next, we are going to check the face. So next, we're going to check the face. You should take off your gloves because it is not necessary. And of course, perform hand hygiene after performing a task. Next is check her face. So we're going to check her face, and we're going to find the temporal artery, which is in the head. Is temporal artery check. Test the cranial nerves. Test the cranial nerves 5. So the patient should bite up. Paakta. Check really. Yeah, muscles. Next is open mouth against resistance. So, kung paano din, after, put pressure here and try to open your mouth. So that is. Next is feel the temporal mandibular joint. Feel the cheeks opening and closing. Open and close. Mouth. Open and close. Feel cracking. Wala. Next is feel the teaching. Next is palpate sinuses. Palpate the sinuses. So I'm going to palpate only two sinuses, the maxillary and the frontal. So first, is this one, this lizard. Okay. This side. The sinuses are okay. Next is inspect the eyes. Going to inspect the eyes with the skull and the face. Let's inspect the eyelid if it is okay. Eyelid plus one mouth, eyes, open eyes. Open eyes. Ito na ito imong sclera. So, imong sclera na yellowing, dapat white na siya. Next is the iris. Focus lang sa ako. Iris is iris is okay. Next, the pupil. The pupil is 5. So, next is the conjunctiva. Kami ay conjunctiva. Open ang eyes. And it is pink. If it's not pink, then there is something wrong. Consult your doctor if you find something wrong. Next is, you should be aware of the eyelid swelling, if there are swelling, jaundice, or erythema. So, we're going to check the eyes if there are anisocoria or the off-centered eyes. So, in this case, her eyes are centered. Look, lantada na. Her eyes are centered. Then we're going to check of strabismus, or if one eye is looking at another direction. So, and I guess there are no strabismus. Okay. The next step is to check the cranial nerves 3, 4, and 6. So, what we're going to do is use this pen light and measure it from the nose of the patient away for 12 inches or so. Then, we're going to let the patient focus on the pen and try to move it. And remember, we're going to look for an involuntary twitching of the eyes. So, let's start. Focus on the pen. And now. Now. Up. Now. Down. Center, side, up, side. Okay, so there are some twitching. So if you notice some twitching, then consult your doctor if you don't know what is wrong. But if you do, then tell me. So the next is we're going to check how the patient's pupil react to light. So we're going to test going to test her pupil. Okay, it's okay. So this is supposed to be performed in a dark environment, but since this is dark, do not base the light on the camera, because the camera is set to be on the lighter side. So we're going to test how the pupil reacts to light. So we're going to test the left pupil or right pupil. Okay, and okay, again. Okay, with constricts. Now then with left pupil. Okay, again, constricts. Okay. Now the patient's pupil must constrict on 1 inches or 1 centimeter in that area. So it should constrict in that area. If it doesn't constrict, then you might have the patient might have a eye problem. So the next is check the accommodation. Let the patient stare off to the distance. Stare off to the distance now. And let the patient stare at this example for an object like this pen light. So let the patient stare at this pen light. Then as I move move it closer, you should focus on it. Okay, huh? Okay, I'm going to focus, focus, focus. Okay, and back. And that was fun. That was perfect. So after you have performed those procedures for the eyes, you should document it as PERLA. PERRLA. The pupils are You should document if the pupils are equal, round, reactive to light, and accommodate. The next thing we're going to do is to check the ears. So we're going to check for any abnormalities or any redness or any drainage. So ask if there is any pain at the ear. Have you have pain in your ear, ma'am?
No.
No, it's not. The next is to palpate outside of the ear. So I'm going to palpate here, here, no strange abnormalities there in the earlobe, none. Is there any pain, ma'am?
No.
None. Okay. The next ear, check the next ear for any redness. No. Check if there is any abnormalities. Is this painful, ma'am? Not. So the next is to move the tragus if there is pain or tenderness. So this is the tragus. I'm going to move this if there is pain. Is there pain, ma'am?
No.
No. On the other side, is there pain here?
No.
Okay. Next is we are going to, where is that? We're going to palpate the mastoid process. Now this is the mastoid process, the bony area here. Here ba to? Oh, here. And here. Is there any pain here, ma'am?
No.
Here?
No.
Okay. So there is no pain. If you feel something off, then you should consult your doctor. The next is to check the you should look for any bumps, lumps, or any abnormalities in the in the mastoid process. Look for any swollen, redness, and touch if it hurt. Then next is the tympanic membrane. The tympanic membrane is inside the ear, but we cannot see it with using only the pen light or your eyes. But there is a tool specific to that, and that is called the otoscope. And that tool is very expensive, so we're going to move past it. But if I were in a medical facility, I could borrow some from the medical facility or medical clinic. So the next is we're going to check the cranial nerve 8. So to check it, we're going to cover one ear and whisper afar and tell and say something, and the patient should hear it and should say what I have said, what I've whispered. We're going to try, huh? Okay, let's start. Chicken cordon.
Chicken cordon.
Nasa talit. Chicken cordon.
Chicken cordon.
Here. Hello? Wala. Balikan ako, ha? Okay. So, her cranial nerves are intact. Cranial nerve 8 is intact. Now, the next is to inspect the nose. Check if the nose is midline. Then also check if the septum is bent or deviated. So, kindly look up, ma'am. Okay. Septum is intact, straight. And ask if there is drainage. Is there any drainage, ma'am?
No.
No. Then, next is make the patient breathe while covering one side of the nose. So, may you breathe in and out? No. Okay. Okay. That there is no blockage. Next is we're going to check your cranial nerve 1. So, I'm going to ask you to cover your eyes and tell me what you smell. So, cover your eyes. You smell
Rubber.
rubber, and this is latex related to rubber, so it is the same. Next is we're going to move to the mouth. We're going to inspect the lips if it is pink. And it is pink and not chapped. Chapped is dryness of the lips, and it is not dry at all. And no sores or scars. There is none. In this case, there is none. Next is to test the cranial nerve 11. 12. We're going to test the cranial nerve 12. Have the patient stick out her tongue. Patient stick out your tongue. And move it side to side quickly. Side to side. Quickly. Paspasin mo. Paspasin. Okay. Cranial nerve is intact. Next is to inspect the mouth. Performing this procedure requires gloves. So you're going to use the gloves, of course. Again, do proper hand hygiene or alcohol test before using the gloves. Okay, this is the right angle. And this sticking glove won't. Okay. Now, before performing this procedure, we need to use a tongue depressor like this. I'm going to open it. Next is to inspect the mouth with, I have to look inside and make sure the one is fixed. Okay, open wide, stick out your tongue, pagawas ang dila. Okay, open wide, and if it is pink, then it is alright. It's okay. There is no lesions or scarring in the one in the mouth. Make sure if it is moist, open wide. It is moist. It's not dry. Next, look at the teeth. Open open lang. And there are some cavities but not a lot. It is normal to see some cavities. Next is to look at the tonsils. The tonsils are way back. Tongue is stick out ang tongue. And why the tonsils are normal. Next is look at the palate and uvula. We're going to look at the uvula, and that is the thing that is hanging down in the throat. So I'm going to say C and say ah. Say ah. Okay, it's vibrating, meaning it is okay. And it is midline, of course. We check if it is midline. And as I've seen the uvula for uvula, and it is midline. Okay, always throw your garbage away. Do not use it. Next Oh, wait, before we're going to end this, we're going to test her gag reflex. So, I... no, no. Extend your tongue. Extend your tongue, please. We're going to test... Okay. Okay. So, the next thing we're going to test is the cranial nerve 10. And we're going to see if the patient can swallow without any interruption or any blockage. So swallow your saliva, ma'am, please. No problems there. Can you talk for a little? Talk for a little.
What time?
Anything. How's your day?
My day is okay.
Okay, there is no problem with their talking and swallowing, meaning the cranial nerve 10 is okay. Next is we're going to inspect the neck. Make the patient, advise the patient to look up. Now with your head, look up. Look at the trachea. Trachea is midline. And look for any lumps. Because if there is lumps, then there is a problem. And so far, I don't see any lumps. Anyway, disclaimer, apologies for the change of scenery. As you can see, it is raining outside and we have to move. So, next is we're going to test the cranial nerve 11. So make the patient move her head from side to side. So may you move your head side to side like this. So up and down. Dayon. Next is test if the patient can shrug with resistance. So shrug ma'am is like this. Like this, okay. So I'm going to put a resistance and try to shrug. Okay, so it is possible. Meaning the cranial nerve 11 is functioning. So the next thing we're going to do is to palpate the trachea. So this is look up and this is the trachea. We are going to feel if there are lumps or any abnormalities in the trachea. And since there are none in this patient, in this case, the next is to check the lymph nodes. Usually the lymph nodes are in the ears of the patient. So there are lymph nodes right here, lymph nodes right here, here around the ear, into the jawline, and to this chin. There are also lymph nodes here and here, everywhere. So, I'm going to check the lymph nodes. Here, there are none. Here, in the back of the ear, there are none. If there are marbles or little tiny balls in the lymph nodes, that indicates there is a fever. So, in this case, there are none. Here, there are none. Here, there are none. And that's okay. Next is we're going to check if the neck is in line with the chin, and it is. Next we're going to check the shoulders, the up clavicle, and it's okay. Now the last and final assessment is going to be the carotid artery. Now the carotid artery is in the neck of the patient, usually right here and right here. So to check for the neck pulse or the carotid artery, you should find the pulse right here, and you should osculate the artery. Use the bell part of the stethoscope. This one right here. Now you should listen to that one. Artery. Find the pulse. Okay. Okay, here's something. Look there. Yeah,
I
here's
did.
something. So look there and read. In and out, then hold. Okay. Gonna put in and out, then ipugong mo. Labas. Labas. Ipugong. You should listen for the swooshing sound. I can't demonstrate you what the swooshing sound is, but when you hear it, you will know. And that concludes our video for today. So that concludes our video for today. Thank you for watching, and I will see you this Saturday because I'm making another video. So see you soon.